Namaste, I am Dr. Meet Kumar and I am a hematologist and a bone marrow transplant physician at Marengo Asia Hospitals, Gurugram and Faridabad. Today we will be discussing about a very important topic. What are the different types of bone marrow transplant? So bone marrow transplant, as we have discussed in some of the previous sessions, that it is a important treatment that is required for some of the patients who are suffering from different types of blood diseases. Today, we will be talking about types of bone marrow transplant. It can be two types of bone marrow transplant. Autologous bone marrow transplant, that means the patient himself is the donor. That means the patient, supposing I am the patient and I have got a Hodgkin's lymphoma or a non-Hodgkin's lymphoma or a multiple myeloma, I will undergo a process called stem cell collection, wherein around 200 ml of my blood will be collected in a machine that will be essentially stem cells. Post that, I will be receiving some type of chemotherapy for 1 to 6 days, after which the stem cells that have been collected from me will be returned back to me. So that is what is called as autologous bone marrow transplant. In case of allogenic bone marrow transplant, that is the second type of transplant, the stem cells are not collected from the same patient but from a different donor, maybe a brother or sister, a father or mother, maybe children, or maybe completely unrelated donor. These are the potential sources from which the stem cells can be used to cure particular diseases of a patient. So these are called as allogenic transplants. We can sub-stratify them into matched sibling donor transplants. If the donor is a brother, real brother or a sister, they can be half matched transplants. That means the donor is half HLA matched with the patient. They can be usually the parents or the siblings of, or parents or the children of the patient. Or the third one, that is the unrelated donor transplant, that is a donor stem cells being collected by a third party, a non-government, non-profit organization that collects the stem cells from a matched donor and it is donated to the patient for undergoing the stem cell transplant. Nowadays, we are talking a lot about what is called as CAR T cell therapy, chimeric antigen receptor T cell therapy. That is a treatment that is useful for those patients who fail the bone marrow transplant. And in this case, patients' own stem cells are genetically modified to fight against their own cancers. So that is called as CAR T cell therapy. Thank you.